I'm Dr. Pravin. How may I address you?
Faisal.
How are you, Mr. Faisal?
Yeah, I'm okay. I only got a cough for 1 month.
Oh dear, Mr. Faisal, how old are you?
I'm 55,
55 years old. You're currently working as?
a bus driver.
Okay, are you Singaporean or immigrant?
I came from Indonesia about 6 years ago.
Do you travel back recently?
No.
So this cough of yours 1 month, has there been any phlegm?
Yeah, quite a lot of phlegm and sometimes I see got some blood. So.
Oh, blood in the phlegm, is it? Oh dear. Okay, do you have any fever, Mr. Faisal?
Yeah, at night I have some.
Okay, any loss of weight, like you feel your clothes looser?
Yeah.
Okay, and how's your sleep? Does the cough affect your sleep?
No, not really, but I sweat a lot at night and I wake in the morning.
Okay, so you sweat because got no fan, or you sweat even with the fan?
Even with the
Oh dear, even with the fan. Okay, Mr. Faisal, can I ask, in your family anyone has a cough like this?
No.
Anyone at
really.
work also? No one, Mr. Faisal, do you have any past medical conditions like diabetes or hypertension?
I have diabetes.
Okay, are you taking medication?
Not very often.
Okay, Mr. Faisal, are you a smoker?
Yeah.
Do you consume alcohol?
No.
Okay, good. Now, Mr. Faisal, do you have any other concerns?
Is it cancer?
No, Mr. Faisal, to conduct more investigations and we'll confirm with you.
Okay.
Okay, but in the meantime, we'll keep you informed. Okay, Mr. Faisal?
Okay.
Okay, thank you and have a nice day.
Thank you.
R Pravin.
Natalie.
Yeah, Mr.
What's
Faisal
up?
from doctor here.
Oh, the back.
Yeah, this is
Soon
X-ray.
X-ray, good.
His acid fast vein.
What about the culture?
Not so fast, doc.
Oh,
Will come
it's
out
not-
in about 2 months' time.
Oh dear, times have not changed, yeah? Thanks, Natalie. I'll take a look. Not good, not good. Let's take a look. What's upset on this one? Not good. Let's call Mr. Faisal back.
Welcome to the next top villain. Our contestants are tapeworm, Neisseria meningitidis, Clostridium tetani, Mycoplasma hominis, Giardia lumblia, and our greatest contestants.
Hi, I am Mycobacterium tuberculosis. I cause TB, which can kill. I am acid fast.
Acid fast, man.
I turn blue with Zell Nelson. I love growing in your lungs. I can mutate.
Whee! Roller coaster!
Mwahaha. The macrophages, they are useless. This lung, it is mine. Oh no, my brothers. These are my fates. Boys, time to look for a new host. Let's go. We are here to stay and destroy. I will be back. I'm back for more. Time to invade. The liver.
TB has been around since the 1950s. Back in 1998, 5.7 in 10,000 had TB, as denoted by the people in red. Back in 2009, 3.9 in 10,000 had TB. The situation has improved. Here's Mr. Faisal, an elderly Malay man.
Good morning, Mr. Faisal.
Morning.
Your chest X-ray came in, as well as your culture sputum from 8 weeks ago.
Okay.
I'm afraid you have tuberculosis.
Oh no, is this serious?
It is treatable at this stage. We'll work together to get you through it.
Okay.
Alright, I'll take care of you. Don't worry, yeah?
Okay, thank you.
No worries.
There are many ways to diagnose TB in the modern day setting. First and foremost, a chest X-ray can be done for pulmonary TB, and one would see consolidations in the lung. Secondly, under microscopy, acid-fast bacilli can be identified with the Zeal-Nielsen stain as well as the Orman fluorescent dye. Histological specimens will show characteristic central caseous necrosis surrounded by a peripheral ring of epithelioid cells, lymphocytes, as well as Langerhans giant cells. Molecular methods such as nucleic acid amplification tests can be done such as PCR, but they are not accurate for drug susceptibility, and the test for drug susceptibility during a culture is the gold standard for TB diagnosis, although it's pretty slow. Patients can be used to obtain the early morning sputum, first pass urine of 6 to 8 ml, CSF, as well as their blood. There are many ways to manage patients with tuberculosis as well. First and foremost, doctors should use the 4 first-line drugs, namely rifampicin, isoniazid, pyrazinamide, as well as ethambutol and streptomycin. Monotherapy should be avoided for it may increase the chances of drug resistance. Patients will be issued the drugs for 6 months duration, 2 months of intensive phase, namely rifampicin, isoniazid, and pyrazinamide daily, and 4 months of continuous phase, namely rifampicin and isoniazid daily. Doctors should issue patients with 2 weeks of medical certificate to ensure that they enter the non-infectious period completely before returning to work. Physicians should notify the TB control units when they have patients with suspected or confirmed TB and organize follow-up appointments on a monthly basis, filling out separate forms for the respective circumstances. Doctors should also warn patients of the side effects of these medications such as hepatitis, visual disturbances, or orange-tinged urine, and offer travel advice if necessary. Doctors should also put these patients under directly observed therapy to monitor their compliance, their adherence to treatment, and to prevent drug resistance. This is available at all TB control units as well as all polyclinics. We hope you've understood the management as well as the diagnosis for TB.